Hello friends, good afternoon. I am Dr. Yogesh Vaidya, consultant joint replacement surgeon at Pinnacle Ortho Center Hospital, Thane. Now that we are into the third week of Unlock 1 phase, I think it is a good time that we have started getting patients calling us for the request for joint replacement surgery. Actually, this talk regarding the role of technology in total joint replacement was a long due talk. In fact, we were planning to do this talk before the lockdown had started. In fact, there were many patients who had planned their elective surgeries of knee and hip replacement, especially during the months of April and May, which happened to be the vacation period for the whole family. But unfortunately, this lockdown came because of this COVID-19 problem, and suddenly everything had gone into a shutdown mode. We were not doing any elective operations during this period. So in fact, these were the patients who had suffered the most, as they could not reach the hospital, and they had to, because they were considered as a non-emergency problem, so they had to live with their hip and knee pain of arthritis during the whole lockdown period. Now that we have gone into this Unlock 1 phase, with the public transport being accessible to the lay person, we have started getting patients now who started coming to the hospital with the request of performing this knee and hip replacement. At Pinnacle Ortho Center Hospital, we are following strict safety guidelines and protocols as underlined by WHO and ICMR. Now we have started our OPD and even we are now gradually beginning to consider starting with the routine elective surgeries. So I feel it is a good time to talk about this topic of role of technology in hip and knee arthroplasty. Because when we get patients in our OPD for hip and knee pain who require a TKR, they have a lot of misunderstandings and some doubts in their mind about the computer navigation or robotic technology. Firstly, let me start by saying that total joint arthroplasty is the most successful operation, the most successful orthopedic operation in the 21st century. Millions of people worldwide have benefited from suffering from knee and hip arthritis, have benefited from this operation of total hip and knee arthroplasty. They have not only benefited from improvement in the quality of life, their standard of living also has been improved. They can resume back their activities of day-to-day living and even indulge in some sporting activities after these operations. The advent of technology in this field has helped to improve the survivorship and the long-term patient satisfaction and the functional outcome scores of this operation. Now, what are the technological aspects in this total hip and knee arthroplasty? To understand that, let us understand what are the key factors which determine the success or failure of any hip or knee arthroplasty. There are two major factors. One is the alignment in which the prosthetic implant is inserted into the patient's body, and secondly, it is the ligament balancing. Previously, any minor degree of malalignment either in the coronal or the sagittal plane would lead to, even of 1 or 2 degree, would lead to a tremendous load on the prosthetic implant and would lead to early wear and tear of the joint, thus leading to poor functional outcome and poor patient satisfaction. Traditionally, the joint replacement surgery used to be performed using handheld instruments and bone cutting jigs. It used to be the surgeon used to rely on his own experience and judgment in taking the bone cuts, doing the ligament or the soft tissue releases, and it was purely his judgment about how to go about the surgery. What we used to call as ocular navigation, or just the surgeon's eyeballing, and whatever the bone cut or the alignment used to be checked with the help of his own judgment. Here, even there used to be 1 or 2 degree of malalignment in the post-operative X-rays. But over and all, if you see, the long-term survivorship in almost 90% of the cases of hip and knee arthroplasty had a fairly good long-term survivorship of almost 15 to 20 years. However, to overcome this problem of slightest malalignment came in the technology of computer-assisted joint replacement. Now, what exactly is done in this computer-assisted knee replacement? It is something like a map or a navigation which we use while driving. In this case, what happens is that there is a tracker or arrays which are implanted onto the patient's limb during the surgery, and a computer picks up the signals from the patient's limb using these trackers, and creates a three-dimensional image of the patient's anatomy of the knee joint, and it provides the surgeon with a pre-operative and intraoperative plan as to how to go about, what amount of bone resection to be done, how much to be released, what is the pre-op alignment of the limb, what is the expected post-op alignment of the limb. The entire map is given, as while driving we use Google Maps. So the computer navigation provides the surgeon with the entire roadmap for the surgery. Similarly, the next stage in this is a patient-specific implant, or the patient-specific jigs, or the patient-specific implants. In this case, it is a next step of computer navigation, wherein the pre-operative CT scan of the patient's limb is done. Here the CT scan or the CT images are sent to the implant company, and they come up with a specific implant or instrument jigs which are tailor-made for the patient's anatomy. Now, why this is needed? Because many a times we see that during the surgery there is a slight mismatch between the patient's anatomy, the size of the patient's knee joint or the hip joint, and the size of the implant which we have in our hand. There is a little mismatch. So we are forced to either use a smaller size or a little bigger size. Even a 1 millimeter of size here and there can make a difference in the long-term results and the patient satisfaction. So using this patient-specific implants, the implant is tailor-made to the size of the patient's knee or the patient's hip joint. So patients get a perfectly tailor-made joint, so he has a more natural feel, the more long-term satisfaction and a good functional outcome. Lastly, the next stage of this computer navigation is the robotic technology. Now, what exactly is the robotic technology? Many a times patients come to us asking whether we will be performing the total knee replacement using the robotic technology, because they have heard so much outside over the television or seen so many ads in the newspapers or any flyers. So they have a misconception that in this robotic technology some robot is going to come and operate, or some robotic surgeon is going to come and do it. But it is not so. In this case, usually there is a robotic arm, what we call as. It is a next generation of the computer assisted technology, wherein the computer gives a plan, but there is a robotic arm which helps to execute this plan. So there are two types. Either it can be a passive robot, in which the surgeon only holds the robotic arm and does the surgery. It's like a burr used to resect the degenerated articular surfaces, and the computer guides that the appropriate, whenever the appropriate level of resection is reached. Or there is an active robot, wherein there is a robotic arm which has got a saw in it. So this saw helps to take the bone cuts and perform the surgery. But it is, in both the cases, it is the surgeon and the surgeon only who is there and who is doing the procedure. It is only the robotic arm that is guiding him or helping him to do the resections and achieve the anatomy. But ultimately, the man behind the machine is very important. So here we are, all this we have seen are the good aspects or the beneficial aspects of the advancement in the technology. But now with this technology, there is a flip side also to that. So what is the drawbacks or the disadvantage or the flip side of this? That first is a huge cost that is involved in these procedures. Not all the hospitals or not all centers can have or afford this kind of technology. Now the cost of this robotic technology usually runs into a few crores of rupees. So eventually the cost of this will be passed on to the patients. So the patient will have to bear the cost of this navigation or the computer assisted technology. So the cost of surgery will increase. Secondly, there is a steep learning curve in these procedures. So for a young surgeon, the curve for learning this technology is a long curve. So this increases the time duration for the surgery, producing increased risk of infection which can happen. Of course, not all centers can afford this, so this technology or this facility is available only in a selected few centers all across India. So I would now also come to one factor, that the propaganda which is being made about this computer assisted technology or the robotic technology, patients carry a lot of misconceptions in their mind. They feel that if it is done by a robotic technology, some robot going to do it, it is a perfect surgery. But it is not so. Studies across the world have shown that there is not, in terms of long-term survival or in terms of the functional outcome scores, there is not much difference between the conventional TKR done by the surgeon himself and done with the use of either computer assisted technology or the robotic technology. So there is not much advantage to that. Of course, there is a lot of centers or lot of surgeons have used this for marketing purposes. They have used it in a marketing their own skills. Of course, the experienced surgeons who are there, they really do not require this technology for their day-to-day surgeries. Of course, this computer navigated technology or this robotic technology has its own specific indications. There are certain cases where computer navigated TKR is a must. If there is a, for example, if there is an extra articular deformity, or if there is an implant in the patient's bone as a result of previous surgeries, then computer assisted technology is a real boon. But it is not really needed for all the routine or the day-to-day patients which we see in our OPD, or for any normal arthritis patients. It is not really needed. If it is needed, there is definitely an advantage, but then it is not mandatory as it is been marketed by a lot of centers. Plus, there are a lot of attributes of the or advantages which are being added to this computer, like patients, it is been marketed like it is a painless TKR or it is a bloodless or a sutureless TKR. It is not so. Computer navigated technology or robotic technology has nothing to do with the pain management. Pain management, in fact, starts or is because of the multiple factors. Nowadays, what we call as, there is a preemptive analgesia, wherein we start the anesthesia or the analgesia prior to the one night prior to the surgery. We are certain medications like pregabalin are given to the patients, which help in reducing the post-operative pain. One of the most important factor which determines the pain of the patient's post-surgery is the intraoperative handling or the soft tissue dissection by the surgeon himself. Plus, use of tourniquet also causes a lot of pain, which is also one of the reason for the patient's post-operative pain. Plus, we use our anesthetist also perform lot of adductor canal block or even epidural analgesia, or certain cocktail intraoperative injection cocktails are injected into the patient's knee, which help to reduce the post-operative pain. It is not the technology that reduces the pain, but then it is this multifactorial pain management. So this, as it is attributed that it will be a painless TKR, it is not so. There is certain amount of pain which is there, but then that is not attributed to this technology. Plus, like sutureless or bloodless or minimal stitches, these are not the factors which are arising out of the technology. These are for other reasons, but then they are marketed to show that it is because of this technology. To conclude, I would say that I am not against the use of this technology, or I am not for the use of this technology. Patients should, before finalizing or before going or admitting in the hospital for this operation, they should first be clear as to what they are going to be faced with when they get admitted. It is not any robo, or it is not any a robotic surgeon who is going to do it. It is going to be the doctor himself who is going to do it. So the purpose of this talk was to just give a brief idea to what to expect when you get admitted into the hospital for your TKR. And there are certain indications wherein computer navigated, which we are also using in our hospital for the TKR purposes, where it is must, but then it is not mandatory that everybody has to undergo this form of a surgery. So friends, we are now starting to resume back our elective surgeries. So you can freely visit our OPD. We are taking all the possible precautions, all the safety measures, all the thermal checks, sanitizations we are doing in our OPD. So you can freely visit us for your long pending problems which were there, you had planned to undergo for the surgery. before the lockdown happened. Now we can start inching gradually towards the elective procedures. So looking forward to see you in the OPD at Pinnacle Center Hospital. Thank you.